Hello guys, in this video let us discuss about charge entry, also known as charge capture. Now charge entry is the third step in the billing process. Once the patient demographics are entered, the files are then forwarded to the medical coding department. And once the coding department assigns CPT and diagnosis codes as per the progress notes received from the doctor's office, the next step is to enter these charges into the practice management system. Now, as the name suggests, assigning the appropriate dollar values to the CPT codes as per the fee schedule is known as charge entry. Now, the charges entered on the claim will determine the reimbursement for physician's service. Now, coming to encounter. Encounter is nothing but the face-to-face interaction between the patient and the healthcare provider or any other medical personnel in the clinic or practice, like a registered nurse. Now the next one is super bill or fee ticket or charge sheet, sometimes also referred to as an encounter form. A super bill or a fee ticket is a sheet of paper on which the provider documents the medical treatment and service details and also the medical complaint and symptoms of the patient. Generally, a fee ticket will contain details like the patient's name, the patient's date of birth, insurance details, and treatment details like the CPT code and ICD code. Usually, healthcare providers and doctors use this super bill or encounter form to communicate charges with the billing office for the services they provided to the patients. Now, in the US healthcare system, all medical services, treatments, and procedures are described using procedure codes or CPT codes. In a similar way, all medical problems, complaints, and symptoms are described using diagnosis codes or DX codes. Now, every healthcare provider will have their own template for the super bill or fee ticket or encounter form. It doesn't have any standard format like a CMS 1500 claim form. Now, let us look at the steps to be considered while entering charges. So this is how a super bill looks like. At the top it will contain the doctor name or the clinic name and the address, practice address. Now the first step is selecting the correct patient. So in order to do this, we need to search the patient as per the details provided on the super bill with the patient's last name or the date of birth. Now, the second step is to search for the date of service in that particular account. So, we are doing this in order to avoid any duplication of charges. In case the doctor's office have already created a charge for this patient. So we are basically making sure that there are no duplication of charges. Since the doctor office also has access to the PMS, sometimes they may create the charge for the patient. Okay. Now the third step is check the provider details like the provider's name and the service location, address, etc. if they are correct and matching with the super bill or not. So the doctor's name as well as the service location, address in the PMS should match with the super bill. Now the fourth step is to update the CPT diagnosis codes from the super bill. Now sometimes the providers may also give injections or immunizations as well as vaccines to the patients when they visit their clinic. That information is also mentioned on the super bill. So as you can see here, the diagnosis is B20 and the doctor marked 99213, which is the CPT code. Now along with this, the doctor also mentioned 90694, which is basically the code for a flu vaccine. So all these details must be entered into the PMS so that when we generate a claim, all these details will reflect on the claim form. Now the fifth step is to check for the insurance information in the PMS. If it is matching with the super bill or any changes have been made. Okay. Sometimes the patient may have switched to another insurance company, in which case the patient will update the new insurance details at the time of visit. So as you can see here, the patient has primary insurance with Medicare and secondary insurance with Medicaid. Okay. So you need to check whether the insurance details that we have in the PMS are matching with the insurance details on the super bill. Okay, and if you observe any changes, then you need to update the new insurance details, and also you need to place a note as to why you made these changes. Okay, so placing a note is very important so that the doctor's office or others will understand why the insurance details have been changed. Now the sixth step is to check for authorization number and the referral number. This applies for specialist claims because there are some procedures which may require authorization, and also some insurance plans will require referral from PCP. Okay. Now the next step is to check for the place of service. Place of service basically gives an indication to the insurance company as to where services were rendered to the patient. Was it in the office, or was the patient seen in a hospital, or was the patient seen in a nursing facility? Now the next step is to check for patient payment, which is copay. Okay. Now the copay details will be clearly mentioned on the fee ticket at the bottom section, as you can see here. Now coming to on-bill comments. So basically these comments give additional information about the service to the insurance company. This information can be printed in either field number 19 of the CMS 1500 form or below the line item of that particular procedure code. Okay, for example, when reporting anesthesia procedure codes, timing will be given in the on-bill comments and the same will be printed in the field number 19 of the CMS 1500 claim form. Now coming to off-bill comments. Off-bill comments are used to alert the user, that means the billers or the billing office, about specific happenings in that particular account. Like the doctor decides not to bill the patient. Say for suppose there is a non-covered service, okay, for which we need to bill the patient, but the doctor decides not to bill the patient. Then they will clearly mention in this off-bill comments, do not bill the patient. Okay. Now, if there is a lot of outstanding balance on a particular account, sometimes we forward it to collections, but in this case the doctor decided not to forward the account to collections. Okay, things like this, professional courtesy. Okay, off-bill comments are only for the billing office and they won't have any impact on the claim. As mentioned at the beginning, sometimes the charges must be provided by the coding team if the doctor chooses to forward the treatment details in the form of a progress notes instead of a super bill or fee ticket, and also if the doctor prefers to mention the diagnosis in a descriptive format. Hope this gives you an idea about charge entry. Thank you.